DMG's Icon is the first ever caries infiltration product. Caries infiltration offers a totally new treatment method for early caries lesions with non-cavitated enamel and a maximum radiographic lesion depth of up to the outer third of the dentine. If a proximal caries is suspected, a bite wing X-ray provides a reliable indication of the location and extent of a potential lesion. Papillary bleeding on probing also indicates the diagnosis, active proximal caries, needing treatment. Tooth number 3 has a clearly visible cavitation of the mesial lesion. Let us take the same tooth number 14 in the opposing arch. In this case, a lesion is visible but less advanced and should be evaluated by X-ray. Here we have X-rays. This confirms our clinical findings. On the right side, in tooth number 3, mesial, the caries has progressed into the middle of the dentine. This, unfortunately, indicates that a conventional restoration is required. The lesion on the left tooth has not progressed so far. In this case, it can be clearly seen that the caries extends through the enamel, just into the dentine. Experience has shown that caries at this stage progresses quickly, so that intervention and treatment is strongly recommended. Above the lesion, perfectly healthy, hard tissue can be seen, which would have to be removed in order to apply a regular restoration. Standard restorative measures sacrifice unnecessary amounts of healthy tooth structure. Clinical evidence also suggests that the first removal of hard tissue often reduces the lifespan of any tooth. In our example, there is a mesial cavitated lesion in tooth number 3. A conventional restoration is indicated in this case. In tooth number 14, radiographic and clinical findings indicate a caries infiltration treatment. Before treatment, the teeth are thoroughly cleaned and any debris rinsed off. The treatment kit includes the main components needed for a successful infiltration treatment. Only a few additional accessories such as a rubber dam are required. The use of a rubber dam ensures absolute dryness, which is a requirement for the infiltration technique, which in turn complements a successful treatment. With specially designed dental wedges, the interdentium is carefully widened. This is not unpleasant for the patient and is perceived only as a light pressure between the teeth. In the first steps, the affected hard tissue is prepared for the actual infiltration. By means of the attached proximal tip, which is perforated on one side only and can be turned 360 degrees, the required HCl gel is applied into the interdentium directly on the affected area only. The perforation of the foil bag is located on the green side of the applicator. A contact time of 2 minutes for the gel must be observed. The use of HCl gel ensures the successful removal of the infiltration-inhibiting surface zone of incipient caries. The acid gel is removed with a water-air spray and is air-dried. Remaining water in the porous hard tissue will inhibit the penetration of the infiltrant and must be removed. This is easily done by rinsing the lesion with the ethanol solution provided. This solution is also removed with oil-free and water-free air. The infiltration process now begins with the help of DMG's specially designed application tips, which access all hard-to-reach proximal areas. The specifically developed resin is applied slowly to the affected area in 2 steps. The first application of infiltrant penetrates deeply for a period of 3 minutes. Excess is removed by use of dental floss, and then the resin is light cured from 3 sides. This process is repeated, whereby the second resin application is made for 1 minute only. By successfully filling the defect with infiltrant, the caries is stabilized and sealed and progression arrested. Following the successful application, the treated and surrounding field is cleared of any excess material. A further advantage of this innovative treatment method is that it does not change in any way the anatomical shape of the tooth. Icon combines state-of-the-art dentistry with the patient's wish for drill-free treatment of their teeth in order to protect and preserve healthy tooth structure. And satisfied patients remain loyal to their dentist. All relevant treatment information is recorded in the patient pass. The treated area is marked in the treatment record. The dentist enters the treatment date and the determined lesion depth at the time of treatment for the patient's record. A follow-up appointment to verify the treatment success can be scheduled immediately.